and it is a problem of apocrine glands. Whereas Ford spots, if you remember, Ford spots are the ectopic sebaceous glands. Okay, both are different, both are not same, both are not same, both are different. Okay, that is important point. If you see carefully, Ford disease has having this Fox term in this. So with the help of that, you can remember this is something bad because the patient is going to have a lot of itching. The patient is going to have a lot of itching, right? Sure. Next is this important disease, acne vulgaris. So remember, this is a chronic inflammatory disease of the sebaceous gland, but even the hair follicles are also involved. So we call it as a disorder of the pilosebaceous unit. And the patients are going to have the polymorphic cutaneous lesions. And most specific lesions which you need to remember, they are called as the comedones. They are called as comedones. And basically this acne vulgaris is the most common variety of the acne. There are other types of acne also. But because the vulgaris term is there, this is the most common variant. Right? And what are the grades which you need to know? There are 4 grades, 1, 2, 3, 4, right? So in the grade 1, the patients are going to have predominantly the blackheads and the whiteheads, which are the white open comedones and the closed comedones. So what is the treatment for the acne? Remember, in all the grades of the acne vulgaris, the treatment is going to be with the retinoids. So retinoids will be there in all the grades. Remember, the 4th grade is very severe type. It is also called as nodulocystic acne because it is very severe. The oral retinoids are used in the grade 4 acne, that is isotretinoin. Whereas in the rest of the grade 1, 2, 3, we can use the topical retinoids. Topical retinoids will be sufficient. And the commonly used topical retinoids is adapalene. Or we can also prescribe retinoin. Retinoid also can be given. So topical retinoids will be used in all of them, 1 to 3. Whereas in the grade 2, patients are going to have papular lesions. So we are going to add topical antibiotics. What's a topical antibiotic which we commonly use? It is clindamycin. Or we can also give nadifloxacin. Right? We can also benzoyl peroxide also, right? In the grade 4, we are going to need, because they are pustular lesions, we are going to need oral antibiotics. What are oral antibiotics which are going to use? Any one of them. It could be M, it could be A, or it could be D. Not all of them. It is any one of them. It could be minocycline, or it could be azithromycin, or it could be doxycycline. Any one of them. Okay, minocycline, azithromycin, or doxycycline. Right, so this is the treatment plan for acne vulgaris patients according to the grade wise. What is the organism? What is the causative organism? Please write down. It's going to be Propionibacterium acnes. It's going to be Propionibacterium acnes. Propionibacterium, or it is also called as Cutibacterium acnes. Recently, it is also called as Cutibacterium. Cutibacterium acnes. सो एजिथ्रो के नीचे डॉक्सी लिखा है. अच्छा, थोड़ा कट हो रहा है शायद. डॉक्सीसाइक्लिन. Basically minocycline, doxycycline, right, they are tetracycline group of medications. Right. So this is also a question. Okay, as isotretinoin, what is the other name of isotretinoin? This was also asked. It is 13-cis retinoic acid. And what is the most common symptom which the patient will experience because of isotretinoin? It is a dryness of the lips, that is the cheilitis. And remember, this is a category X medication, so teratogenic. If we start the patient on isotretinoin, we have to advise a washout period or a drug-free period of 1 month, at least 1 month. The female patient should not conceive, right? Otherwise, there will be teratogenicity. And remember, this is going to derange the lipids, so fasting lipid profile and liver function test must be done prior to starting the isotretinoin. So rest of the others are the adverse effects because of isotretinoin, not very important. So next condition is the phymatous type of a condition which is going to affect the sebaceous glands. So what is that? It is a acne rosacea. Can anyone remember who is that actress who was having this rosacea, acne rosacea? So it is Bujitale, Sai Pallavi. She was having this acne rosacea where there is going to be erythema, blushing, flushing, telangiectasia present over the cheeks, right? So Om Puri might be having this, but he also has the smallpox. Okay, yeah. Chalo. So in this acne rosacea, what happens is there could be thickening and irregularities of the nose, as you are able to see here, of the chin or of the earlobes. So this nose involvement is called as rhinophyma. Thickening of the and irregularities of the nose is called as rhinophyma. This is also called as potato nose. And this is called as gnatophyma, and this is called as otophyma. Phyma is basically thickening of the skin, thickening irregularities in the skin. So these are the questions. Obliteration of the apocrine duct will produce which condition? Apocrine duct obliteration is going to produce which condition? Absolutely right. So very good. Amitabh Bachchan is telling the answer. So it is a Fox-Fordus disease, which is also called as apocrine miliaria, right? So this picture is showing you this Fordus spot. So what is this Fordus spots because of?